Patient experience. When we talk about the patient experience, we talk about the full journey of the patient to the healthcare, starting from thinking about what type of service I need, how to contact them, how to reach to the healthcare facility, and how to engage with the healthcare professionals, with the provider of care, till the patient leave the healthcare with the service happily, with the information, and with exactly knowing what to do next. We're going to talk about a full journey that has a lot of interaction between the recipient of care and the provider of care. This is exactly what we call it the patient experience. Patient experience is not at all about how to make the patient happy, but patient experience is about every single requirement that should be there in the service to be delivered properly, effectively, with compassion, with empathy, with reliability, accountability, and putting in mind surely the quality and safety at the same time. Imagine that we do have a patient that need to do a phlebotomy for that patient, collection of the blood sample from the patient. We might come up with the staff, the provider of care, collecting the blood sample with a little bit so much into the process, but not with the human being he or she is collecting the blood from. With so much into technicality, like how to take it and take it properly, but without a smile. With so much into the amount I need to collect properly, but not to tell why I'm collecting it. With so much deeply into the infection control that I have to follow, without telling that, take care, I'm gonna take it at the moment, relax, I'm the right person to do this. I have done it multiple times before. You know, you will never feel it because this is me. I'm the experienced person and I'm so gentle when I'm doing this. Imagine that after all of this, with the technicality, with the implementation of the infection prevention control, with withdrawing the amount I need, so it was perfect. No, it end also by pain. It end also by bruises. It might also end by any means by infection. So how the patient gonna feel it? How the patient can draw the picture of this experience, of this event? Surely not happen. And the patient is going to describe this experience, our experience of collection the blood from my arm, as being a very bad experience. Why? Because it wasn't as expected to be. On the contrary, imagine that you attend your patient and you greet the patients, putting a smile on your face, telling at the moment, I'm going to collect an amount of blood from your arm, but this is what I'm doing every day, and I have did it plenty of times, millions of times over the last few years. You'll never feel it, so stay calm. I will help you to stay calm with a smile on the face, with the appropriate technicality, quality, and infection control and safety, with a simple empathy. I know that it hurts, but with me, you will never feel it. So with a little words that make alleviate the patient anxiety, then it's gonna be a perfect experience that me may even in the next time, I'm gonna ask for the same service provider. This is what we call it, the good experience. That's what we're going to talk about in this presentation. We talk about the journey of the patient through the service, going from one service provider to the next, and every time we provide what it should be there. We provide the dedication, we provide the quality service, the safe service, we provide empathy, we provide care, we provide good attitude, provide excellent communication, and we tell and we answer questions and we guide and we refer and we integrate. This is exactly what we're going to talk about in the patient experience. Therefore, when we talk about the patient experience as it is written in literature, they talk about the end-to-end journey, the full journey through the continuum of care. We talk about continuum of care, meaning the full journey, and I have a very interesting video by the end of this presentation with a new technology and innovation that will tell us how to have a perfect continuum of care with a high level of patient experience. With putting in mind the patient experience, we're putting in mind how to move forward to what we call it and what we aim for. That is the patient-centered care. Again, every time we're talking about the patient experience, we think about how much we are responsible to the patient, how much we are respectful to the patient, how much we provide what the patient prefers, and how much we reply to the existence value of the patient. The patient needs the value of dignity, of respect. The patient needs the value of confidentiality. The patient needs the value of transparency. So again, that's what we are going to do when we provide a good patient experience. By listening carefully to the patient at the same time, we're going to learn a lot. We're going to learn where exactly we are so good and where exactly we need to improve. And even we can take this to the next level of training, the next level of improvement, and the next level of boosting our services to meet the future needs and expectations of our patient. Again, this is how to achieve the patient experience. So patient experience is not about like measuring, sending client satisfaction survey, come up with numbers and figures and chart saying we are so good at this. Currently, we are 70%, 90, 80%. No, it is not about assessing how much the patient is happy with exactly what I have give, with exactly the number of questions I have asked. No, it's not about the 5 or 6 or 7 questions I have asked. This is all about the patient. No, this is exactly what I requested the patient to answer because I know it's good from my side. That's why I gave it to the patient. But patient experience, we talk about what should be done to the patient at every single step the patient is taking within or even before attending the facility. Like how the patient is going to take an appointment. Is it like simple and easy through our website? Is it simple and easy through the call center? And how the patient is going to be directed to the entrance? Can the patient find parking easily? When the patient will attend, is there anyone to help the patient, especially if they are with a special need, like they need a wheelchair? Is it easy and simple to go over the steps, or it is difficult to the patient to climb the steps? Do we have some people at the entrance who will guide the patient which direction to go? Do we have a good people with good communication skills at the beginning to talk to the patient and put a smile on their face with a proper dress code that reflect how good we are, how elegant we are, how committed we are to quality and safety, to know exactly to whom I'm talking when I see the badge on the staff. And I know this is the receptionist, this is the assistant, this is the nurse, this is the doctor. So I can simply and easily differentiate between them because there is a tag with the name and position. So I know exactly to whom I'm talking. So I can tell what I need to tell to the group, and I can withhold what I need to withhold because they are not necessary to know exactly what I have. Do I have like signs and guidance on the wall to tell me where to go? And do I have a nice place to sit in and relax in the waiting area? Are there a lot of posters and material to read and watch so I can properly use the time I'm waiting for the service? Is the patient received by people who are smile, especially at the clinical area, like the nurse, the doctor, the allied healthcare professionals? Is it simple and easy to talk to the doctor, and the doctor is actually giving me the time to listen to? And do the doctor answer the questions I'm asking and clarify what is my problem and what should I do in the future and share me in the decision-making process? And do the doctor tell me where to go after that and how to contact the doctor in the future? This is all about the patient experience. So when you go for the client satisfaction, you have a 5 or 6 group. Are we good? Yes. But what exactly we are good at? Are you going to recommend us? But for what? For what service exactly? And are you happy with? So this is not exactly what it should be there. Okay. But if you would like to go with experience, you have to take it from the beginning. This is exactly the patient experience. And as I said, it will boost us toward the future. It will boost us toward like what to do, how to do, when to do in the future to satisfy the patient. Number one, the basic needs. Number two, the expectations. Number three, the final atmosphere of perfections, safety, and quality. So from the beginning, when we go through the process of the patient experience, we need personally, at the personal level and at the organizational level, we need to have a definition in our facility, like how we define patient experience. So we need to put the dots, like we need to write some words and then period at the end saying whatever is before should be happen in the facility. So a question for you, how you personally define patient experience. And what does patient experience means to you? Today, you are the provider of care, but tomorrow, or maybe at the same moment, one of your beloved one, like one you love, the parents, the family members, the friend of you, is at the moment, is a recipient of care, is a patient. So how you want that person pass through an experience, which is like a good experience, a bad experience, acceptable experience, magnificent experience, to come back, to never come back. So how you personally define patient experience. One of the major entity in the world that talks about the patient experience is the Braille Institute. I'm going to share with you a video that illustrates how they define patient experience in Braille Institute. Please watch, learn, and enjoy.
The patient experience begins when we have our very first contact with the patient.
The sum total of every touch point, every episode of care throughout an overall continuum.
Everything from the first phone call or first visit to the website,
a seamless transition from primary care to specialist,
to the last interaction a patient has with your organization.
We can't make an impact on why they're there. We can impact on how we make them feel while they're with us.
There is a compact that exists between the patient and everybody that they come in contact with.
We want them to feel comforted. We want them to feel like they're at home. Staff should be knowledgeable with what they're doing and compassionate about what you're going through.
Emotionally connect with them so that they really feel that we genuinely care.
It's all those interactions from the unique healthcare systems culture.
It's everything the patient sees, hears, smells, touches.
It's the stories that people tell.
And that's a far cry from more traditional missions or visions that focus more on the business objectives.
It's the clinical outcomes, it's how they feel, it's all of that together.
A one-on-one friendly interaction between providers of service every step of the way.
People don't remember what we say or do, they remember how we make them feel.
Every part of that patient experience has to be a wow.
So at the definition, they define the patient experience as, let's focus here, the sum of all, number one, interaction. Shaped by, so the type of the interaction is shaped by the culture, the organizational culture. And this interaction will influence the perception of the patient, that influence the patient perception. Is it at a one point of care? No, across the continuum of care. So we talk about the following. We talk about all interaction, and we talk about the organizational culture, and we talk about the continuum of care, and we talk about how the patient is going to perceive all of this. So you might smile at the patient, but the patient perceive it as being like lovely person, smiling at me, greeting me, or the patient might look at this smile like this is type of the policies that you do at me at the moment. So again, we're going to talk about all of this. We talk about all interaction. So when we start talking about all interaction, we talk about from the first step, when the patient is thinking how to come up to this facility, how to contact them, and if I am there, what happens, and when I'm in the clinical area, what happens when they refer me, when I move from one place. So all of this interaction, this is part of the patient experience that's shaped by the organizational culture. Now, when we talk about the culture, okay, when we talk about the culture starts by putting down the value that we need to implement in the facility. We talked about the value yesterday, and we're going to talk about the value at the moment as well. So what type of value you want? I highly recommend that you take a pen and paper and you start to write down. So if I'm the owner of the healthcare facility, the hospital, the medical center, the specialty center, so what type of value I want me and my staff to behave in this way? So do you need a value of compassion, of empathy, of confidentiality, of quality, of safety, of teamwork? So just write down what type of value you want you and your staff behave in the same way. So you're gonna find that your interaction, if you said our value is empathy, so the interaction gonna be with empathy. And if you said our value is confidentiality, so for sure, every single word gonna come up from the patient will never be disclosed except for the legal purpose. And if you said quality, so for sure, we are expecting that you have the highest positive outcome. And when you say safety, so what we expect that every single activity you do is according to the patient safety practice. And you do have also the facility safety practice as well. So when you write down your own values and you educate the staff on those values, and I'm going to say force the staff to follow the value. So going to be a part of them, the second nature of the staff, like the values actually in my day-to-day behavior. And I'm going to tell you how the value going to be achieved when you achieve the culture, the organizational culture with good value. So you're going to find this culture and this value simply and easily are available everywhere. So you said that we're going to have the value of quality and safety. So in your vision, you say our vision is to provide high quality and safe healthcare to the community. So you're going to find the value is already included in your vision. And you're going to find that the value are included in your norms, like how you talk and behave in a responsible way. You talk and behave with respect. And when even you go from one point to the next, you have an attitude and you have a good behavior every time you are there. And even you're going to find this is available even in the symbol that you have. What does it mean even in the symbol that I have? Like, you're going to find that the symbol of hand hygiene here and there, it's safety. Wash your hand, it's safety. Avoid like use a mask when you cough, it's safety. The fire alarm, how to use the extinguisher, it's safety. So even a lot of the posters and sign here and there are symbols that reflect the value of safety that you said. The normal habits and belief of the staff that I should wash my hand before and after attending the patient, it becomes like a habit. Patient identification, the proper patient identification become a habit. So you're going to find that whatever value you have written down in the documents and it have been shown and sent to the staff to implement it, become a second habit, and the staff are doing it, then all of this is going to be very clear to the patient and will be considered by the patient. So every single interaction going to be shaped by the type of the value you have. What if you have the value of aggression? So you're going to deal with the patient with aggression. What if you have the value of irresponsibility? So you're going to omit, going to be not responsive to the patient. The patient going to wait for a long period of time because you are not responsive. As a team leader, you're not responsive. So the staff are not responsive. So the patient is waiting for a long period of time unnecessarily. And you're going to come late. And you're going to move earlier. So patients are waiting for the service for a long period of time. Irresponsibility, and you are irresponsive because of them. So depending on the type of the value that we have, our interaction gonna be shaped, and gonna be shaped all through the continuum of care, starting from the person who's actually receiving the patient once he or she attended, till the patient leave the healthcare facility. All right, so this is how our value gonna be simply and easily reflected on our day-to-day behavior. Okay, now how the patient is going to see this, how the patient is going to perceive all of this interaction. It's highly important to understand the word perception. Perception, like how I personally see things. Like if you give me this cup, I might see it like half full or half empty. This is how I personally perceive it. So you might give the patient a talk about a subject. So the patient might see it from different perspective. The patient might see it from the positive perspective or from the negative perspective. So every time you are sharing with the patient an idea, so you have to make sure that the patient receive what you have shared in the right way. So once you tell the patient, this is the diagnosis and this is the options for the management, I personally, as a provider of care with my experience, I prefer this. So how do you find what I have said? So you have to have that read back from the patient, like what type of information you have sent and how the patient perceived it. So you have to tell me that I'm gonna die, or you have to tell me that there is a chance for me. So again, you have to make sure that how the patient perceived the information. So what you have said at the moment, that I have to do the surgery at the moment, or I can wait. I don't know. It's not clear for me. So this is how the perception of the patient, all right? So you think that my condition is serious or it's okay? Yeah, it's gonna, like, for example, it's gonna improve with time. Again, so you have to have the feedback from the patients to understand how the patient perceived this type of the interaction. So when we talk about the patient experience, as I said, it's every single interaction. And this interaction is shaped by the value that we do have in the facility. And it's all across the continuum of care. And finally, how the patient perceive it, like how the patient see it by the end of the day. See how you can see this, all right? When you talk to the patients, you have to keep in your mind the multiple barriers that we do have when we deliver the information to the patient, again, because this will make your patient either happy or unhappy. Know exactly what to do, or do not know exactly what I should do. So try when you communicate with your patient to avoid the assumptions and hint. So give a simple message, a clear message, a brief message, simple words, direct and to the point, slowly and clearly and loudly. See, simple thing, just talk slowly, clearly and loudly so the patient can hear you. Look at the patient eye. Make sure that the patient understands. Ask questions so the patient can answer. Or even you can ask the patient to ask a question to clarify what's like not so much clear to them. All right. So I have said a lot of the in every single encounter across the continuum of care. So I'm going to give you a lot of the examples about what do I mean by the continuum of care and how the journey starts from the beginning to the end. Again, Bralin Institute come up with a nice video that will show us a journey of the patient. And a lot of the provider of care are there. Some of them administrative provider, some of them are clinical providers, and other are technical providers, even working with the facility, but still those who are working in the facility, even the housekeeper is part of the patient experience. Even the maintenance is part of the patient experience. So let's watch, learn, and enjoy how every single bits and pieces in the healthcare is part of the patient experience. So please focus on this once you return back to your healthcare facility. at the beginning, let's know that I personally, the patient experience, I'm the doctor, I'm the patient experience. When the patient will leave the facility, the patient is going to talk about me, like how I talk to the patient. I'm the nurse, I'm the patient experience. When the patient will leave the hospital or the medical center, they're going to talk about how good or how whatsoever is the nurse who took care of me. I'm the allied healthcare professional, the lab staff, the radiology staff, the physiotherapy staff, the pharmacist. So that when the patient will leave, they're going to talk about the experience that they have in the pharmacy, in the lab, in the radiology, and they're going to talk about it because this was an experience. And also, the patient is going either to recommend us or, like to warn the people about us. So it's highly important from now on. Just think about everything. The kitchen is part of the patient experience. Housekeeping is part of the patient experience. Administration is part of the patient experience. The call center is part of the patient experience. A huge number of activity is actually a part of the patient experience. But what happened? We start to look much more broader than this. We start to go from focusing on patient, focus on the patient and family experience. So what we offer the caregivers and the family members when they come to the hospital setting, come to the medical center with the patient, what we offer them to improve their experience. And then we moved a little bit further and we thought about what about us, the staff? So we go from the patient experience to the patient and family experience, to the people experience, the human experience. So we start to talk about how we make our facility safe to the people in it. So we start to talk about the staff safety, the staff security, the flexibility of the working hours, the compensation, the training to enhance the staff experience within the healthcare facility. So we are moving a little bit forward and to the next level with the experience.